The endometrium is the inner part of the uterus where the embryo plants. We know that when we talk about a good endometrium, it's because the thickness is around 7 millimeters or more. But not all the patients may have that thickness. So the main causes why that endometrium could be not so thick are several ones. The first one is the infections that the endometrium could have in the past that we know that may affect the innermost layer. Some other alterations such as iatrogenics caused by several curettage that can affect that layer also. But in the main and the most cases, we know that there are no specific reason why the endometrium is not so thick. So if we want to make that endometrium be thicker, there are several options. The most common ones are the natural cycle, a cycle using estrogens, and gonadotropins. Let's talk a little bit about the natural cycle. It's quite common to try to thick the endometrium just using the natural hormones that the patient may secrete. So with that cycle, we will take advantage and use the natural secretion and production of hormones to make that endometrium be thicker. So the idea is just following how the follicle grows, and due to that growth, the endometrium will be affected by the estrogens the follicle will create and will be thicker. In some occasions, we prefer to use estrogens, as we know that the endometrium is a hormone-dependent tissue. So normally the estrogens are used vaginally, orally, or sometimes using patches. So it's quite common to have a good endometrium due to that estrogen's action. In some other cases, when the endometrium does not react properly, we need to use a different treatment options, such as gonadotropins. So we try to stimulate the ovaries with a low dose of gonadotropins, trying to affect the endometrium in a good way and trying to thick that endometrium. So in the end, the estrogen that will be produced by that follicles that are growing will be affecting the endometrium in the end. But sometimes things are not so easy. So in some specific occasions with treatments that need to be used in a different way because that endometrium thickness is not as good as we need to use different treatments. Some of them are quite used and quite known, such as the aspirin, that we know that is a vasoactive agent that may help in increasing the blood flow of the endometrium. It's a quite useful treatment and is quite used in that kind of patients where the endometrium is not thick enough. A different treatment is the vitamin D and the betoxifilin that are known to be antioxidant agents and can cause a vessel dilation. In the end, what we need to see is that there is an increased blood flow in the endometrium. So normally that treatments are added to the most common ones, trying to improve that endometrial thickness. A different treatment, which is one of the most, with the newest ones, is the granulocyte colony stimulating factor that is known to increase also the flow and affect the endometrium in a good way. The main problem with that last option is that there are some controversial on that. There are some studies that show a good response in the endometrium and good effects on that, but some others don't show that kind of effect. So in the end, it's not very clear if it could be helpful or not. In the end, when we have a patient that has that thin endometrium, we try to do our best and we try to add several treatments trying to improve that endometrial thickness. The same happens with Viagra, which is the brand of sildenafil, which is a treatment that sometimes is added to other treatments such as estrogens and so on, trying to increase the blood flow also. The effects are quite helpful normally, but it always depends on the patients. Not all the patients will have the effect we want to with such treatments.